Sometimes, people say, I would rather die than have pain.
I believe that if aggressive spine surgeons are doing 10 surgeries, out of which only 3 or 4 actually need surgeries. Everybody has pain.
Yep.
So what is this chronic pain? Why is this word chronic next to it? And what is that you do as a chronic pain physician?
And they say, why don't you give me opioids? Why don't you do this surgery? I say, I wouldn't give it to my own family, so why would I give it to you? I tell the patient, if I had done the MRI the day before you had the pain, that bulge would have been almost exactly the same. Some days you're like, what am I crazy? What am I doing here?
And I think you're like a library of pains,
Because there's no test in the world that shows pain. We should all have humility in our own ability. 10 years back, before I went into anesthesia, if somebody had died, going to do pain doctor, I would have said, what? Who wants to deal with pain,
Not doing the scan is a problem. Doing the scan has limitations. Eventually, all I'm trying to say is a right clinician who understands back pain, neck pain, makes the right decision is the key to make sure that the minimum effort is put to the maximum benefit you have for the longest period of time.
Like one of my professors say, half of medicine we don't know works or doesn't work. The problem is we don't know which half. I'm starting to learn about the yoga aspect, the breathing. I used to make fun of it. How can you breathe and you breathe funny through one nose?
So if every disc that is there bulge in the MRI scan you remove, you'll all become billionaires.
No human being wants to go around life saying I'm in pain.
Have you had any crisis situations or near crisis when you're flying? The first time when I got into the flight, I'm thinking small flight, what's going to happen if it breaks down and something happens, what if I die and all of those things. Then I said, see, this guy is a doctor, successful guy. If he's trusting his own life in his own hands, I don't think I should worry about that. If he goes down, we also go down.
I went into anesthesia and pain thinking, how hard can this be? And some of the chronic pain patients we see, I don't wish it on my worst enemy. I mean, it is torture.
I've kind of been a guinea pig for any new drug comes, they try it on me.
Giving up hope is probably the last thing you should do.